Let's talk about Hasselbach's triangle. All these triangles are tricky, but I'll make it quite simple for you. Now, on the medial end, imagine this is the muscle that is present. What is this muscle? This is your rectus abdominis muscle, right? On the lateral side, you see this is the lateral wall. From this component, you will have the anterior superior iliac spine. This is the pubic rami. This is the pubic tubercle. This is the pubic symphysis. And you see this is your pubic bone, right? So this is nothing spectacular. We all know it, right? So when you look at this, this is the rectus abdominis muscle that is present. That is the lateral border. Next, you will notice that this is your inguinal ligament from the anterior superior iliac spine all the way to your pubic tubercle. And you posteriorly, it is made up of your fascia transversalis. There is a blood vessel that is going to go and it is going to arch out like this from the external iliac. And this blood vessel that is arching out is your inferior epigastric artery. Now, between the inferior epigastric artery, the lateral border of the rectus abdominis muscle and the posterior wall, or I can say inferiorly, it is formed by your inguinal canal, right? So this is your Hasselbach's triangle. So if I quickly conclude, the Hasselbach's triangle boundaries are pretty much laid down as we can see. On the medial end, it is formed by the lateral border of the rectus abdominis muscle. So this is the medial boundary. The medial boundary is formed by the lateral border. It is formed by the lateral border of the rectus abdominis muscle. Whereas medially, it is formed by the inferior epigastric artery, and inferiorly, it is formed by the inguinal canal. It is formed by the inguinal canal. And as we all know, Hasselbach's triangle is the area of weakness through which your direct inguinal hernia will push out, right? The entry point for direct inguinal hernia is here, and then it is going to come out from the superficial inguinal ring. If you want to conclude it, this inguinal canal, this is your superficial inguinal ring that is present. The posterior wall is made up of fascia transversalis, and that's your Hasselbach's triangle. Thank you.